I think it's really important to talk about it because it has a lot of connections with symptoms that people present with. It's one of those issues where if we don't ask the questions, then it's actually very difficult for the patient to bring it up. So it's kind of our role to allow the patient to talk about it. It's a difficult subject for anyone to talk about because it's personal and you don't want to cause offence to the patient. I think the other reason is that our consultations are becoming very crowded with other issues that we have to do, like cardiovascular risks and sore throat protocols, all of which are very important and very relevant, but there is only so much time in a consultation, and often if you're trying to talk about sexual issues or something that's a little bit sensitive, you kind of have to build to that. If someone's going to talk to you about something that they don't think that you're necessarily going to approve of, then if you have some language, for example, you know what ecstasy tablets look like and you can talk about that, then that kind of means, well, look, hey, I'm actually interested in this and I know about this outside of this consultation. I found out this information. Kind of normalises it. When they come to see the doctor, they expect the doctor to delve and ask questions. And as long as we do that in a sensitive way, we can actually start to do it relatively quickly in the consultation and with really specific questions. And that way we can cover a lot of ground quickly. I don't think any of these things are things that you can dive into, and I think that you do need to use signposting skills to allow the patient to know that you're going to talk about something sensitive. So by that I mean that you introduce it in a way that says, I'm actually going to ask you some questions that you might find a bit embarrassing, but I need to know them because it's going to enable me to put together the picture of what might be causing your problem. So please don't be offended, and I often ask my patients these kind of questions. So once you've done that, then I think that you can actually ask anything. And you can actually be quite specific about it. You know, are you a person who takes risks? What do you do for fun? I thought that was a very good question that one of the delegates brought up themselves. We should have antennae out for sexual behaviour, drug behaviour and risk-taking behaviour, and we should be asking lots of our patients about it. You know, some of the examples I gave in this talk were like an old lady with a recurrent UTI. You know, she could have a sexually related problem because of that, but if we don't ask her, she's not going to volunteer that information. Someone who presents with chest pain may be getting chest pain due to increased sexual activity. You know, these are questions we really need to be thinking, well, why am I not asking it, rather than why am I asking it? Cultural difficulties are hard, but I think that it's about the patient in the consultation, it's not about you. So you need to put your own cultural ideas and upbringing aside and ask the relevant questions which might lead you to the answers that you need to know.